Hi, I'm Allie Manson, Vice President of Government Relations and Advocacy for ZERO, and welcome to Taking It to the States, Advocacy in Your Backyard. In this session, you'll learn about what ZERO is doing in state houses around the country to save the lives of men with prostate cancer, how we work with partners in this effort, and most importantly, why it matters. I'd like to introduce the Zero Cost to Prostate Cancer Screening Initiative. This is ZERO's effort to eliminate cost sharing for prostate cancer screening for high-risk men around the country. We do have a bill in the US Congress to advance this effort, but today we're here to talk about how we move the effort forward in the states. So let's start at the beginning. What's the problem? I hope that everyone here at the summit has already heard some of these numbers. The American Cancer Society estimates that 268,490 men will be told that they have prostate cancer in 2022. And 34,500 will die this year. That is 93 a day. The 5-year survival rate for a patient diagnosed with local prostate cancer is almost 100%. For patients with advanced disease, it drops to 30%. So those 93 men a day, that's oftentimes men who are diagnosed with advanced disease. Prostate cancer is very survivable if you catch it early. Simply put, screening saves lives. The prostate-specific antigen test is the gold standard for prostate cancer screening. It's a simple blood test, and it isn't perfect, but most men with prostate cancer are diagnosed because they first had a PSA test. Once a man starts having noticeable prostate cancer symptoms, it's often because they have advanced disease. So there's a little bit of controversy about the PSA test. The United States Preventive Services Task Force, which grades preventive care services, has historically undervalued the PSA test, especially for men at highest risk, including those with a family history and Black men. And who cares though, right? Who cares what an alphabet soup organization says about a PSA test? It matters because since 2010, the USPSTF's recommendations determine which preventive services are available to people without out-of-pocket costs, like cost sharing, co-payments, co-insurance, or a deductible. Insurance companies make some preventive services available without cost sharing in order to encourage people to receive them, right? It sends a message that prevention is important. We also know that cost sharing, even when the amount seems small, can be a barrier to receiving that care, especially in financially insecure or medically underserved populations. So what's our goal? ZERO envisions a world where all men have access to free and accessible prostate cancer screening. And that brings me back to the Zero Cost to Prostate Cancer Screening Initiative. These are bills around the country that eliminate cost sharing for prostate cancer screening for high-risk men. We're turning this map blue, one state at a time. As you can see, Maryland, New York, and Rhode Island have already passed this kind of legislation. So in Rhode Island, it was 2021, Maryland, it was 2020, New York was 2019. And as you can see, the criteria in each state is a little bit different. But that's because each state's a little bit different and how their state code is written is a little bit different. But these are the states that already make prostate cancer screening more accessible. In 2021 and 2022, bills have been introduced in several more states. First of all, Rhode Island passed that legislation last year, but there were also bills in 2021 in Texas and California. This year, we've already seen bills introduced in Virginia, New Jersey, and Illinois. And one of the most important tools we have for passing this legislation is the coalition we've built and the partnerships we rely upon. The American Urological Association and the American Association of Clinical Urologists have been our biggest partners in this effort. We've been incredibly fortunate to have many other supporters, but I want to extend a special thanks to my colleagues at those organizations. And to give you an idea of how we complete the effort together, I'd like to welcome the panel today. Everybody can pop up and wave. I'll introduce them briefly. Shanita Swiggett is a ZERO champion and an advocate who fights in honor of her grandfather. Dr. Yale Shulman is a private practice urologist in Jersey City, New Jersey, and he's also affiliated with the NYU Langone Medical Center. He's also president of the Urology Society of New Jersey and a longtime health policy advocate. Ross Weber represents the American Association of Clinical Urologists in State Government Affairs. So thank you all for joining me. I'm so glad you could be here. And I want to start by asking Ross, can you give us an update of kind of where we are? We're going to talk specifically about New Jersey in case folks didn't guess from our panel. but where we are in New Jersey and how we got here.
Yeah, thank you, Allie, and thank you, ZERO, for providing this opportunity for us to share the news about this initiative. In New Jersey was our first target this year, and we had a great meeting early on. Thanks to we had some industry partners who connected us with a lobbyist and essentially allowed us to borrow their lobbyist for this effort. That lobbyist was able to get us a meeting with a potential sponsor. That sponsor was Senator Troy Singleton. Senator Singleton happens to have a relationship as well with Shanita, or represents her area. At any rate, we had a great meeting with Senator Singleton, raised the issue, discussed the issue. He was on board very quickly. And within a few weeks, we had a bill introduction in New Jersey. The prior successful efforts are all very important and will do good things. A great thing about the New Jersey example is that not only does it call for prostate cancer screening, it also calls for coverage for select follow-up services. And I'm looking at it right now, and those are certain urinary analysis, serum biomarkers, and medical imaging, including but not limited to MRI. So that's a really big advancement as far as we're concerned in these bills that are being introduced state by state, effort by effort. Yeah, again, the coalition that's come together, ZERO, AAUA, ASU, patient advocates, in other states, large urology groups have been very active as well. So as you sort of intimated, this coalition is getting bigger and more advanced, and it's really great what we're accomplishing state by state.
Ross, we had been kind of working on this in a couple of different states together. And then when the New Jersey meetings came together, that was where we were able to reach out and say, okay, we need folks in the state, right? We need a doctor, we need a patient advocate, we need folks who can speak to, their personal experiences and, do it as New Jersey constituents, because neither you nor I live in that state. And so, Shanita, that was when I emailed you. You were, you've been a ZERO champion for a long time. You've advocated at the summit before, but this was, I wanted to ask you why were you jumped on it? I mean, you were as willing and wonderful. So tell us why you were happy to advocate in New Jersey.
Thank you for having me. ZERO is something that is so special and important to me. So much so, just to address the elephant in the room here, I had oral surgery yesterday and I was like, no matter what, I need to be on here. I lost my grandfather to prostate cancer in April of 2017 when we found out that his prostate cancer had come back stage 4 and there was pretty much nothing that they could do. I wanted to study and research, and the first thing that popped up was ZERO. I found a run walk. At the time I was living in California. So I did my first run walk in Long Beach, California, and I met some wonderful people there and was able to get involved. And I moved out to New Jersey and met more wonderful people in New Jersey. And it's been something that's been near and dear to my heart because, just to continue to learn and spread awareness where I can and talk to whoever who will listen. I'm not normally the most talkative person in the room, but if you get me talking about prostate cancer, I won't shut up. So, it's been something wonderful to me to be able to be part of a platform and have a platform to continue to raise awareness in my grandfather's memory. I have brothers and a husband and uncles, and just there's so many men out there who are just so unaware or who don't want to talk about it. And so the opportunity that when you emailed me, I'm like, yes, I'm all for it. Whatever you need from me, I'm there, I'm in. it's never a question. It's never a matter of can I, it's a matter of yes, I will clear my schedule, because it's the raising the awareness is that important to me, and just Zero as an organization and all of the wonderful people that I've met. It's been more like meeting and getting to know family from all over the place. So I want to continue for as long as I can and continue working with Zero and continue raising awareness and do whatever I can to help on whatever platform will allow me to talk.
I'm so glad you're part of this family. It was, I mean, you jumped at it, and that was fantastic. And Ross reached out to Dr. Schulman, and I know, Dr. Schulman, you've been an advocate for prostate cancer and other policies for some time, but talk to us about this time. Why this one?
Okay, I'll talk about my involvement with Zero. I wanted to thank everybody here for inviting me to participate in this panel. But Shanita, you also told us last time a little something else about your where you live now as a constituent of one of the congressmen or state senators. Did you tell us that today? I mean, that may be important in terms of your personal connection. I mean,
oh yes, I'm sorry. I'm in Burlington, New Jersey, which is a constituent of Senator Singleton's.
Because if we're doing this at a state level, and that's what this panel is about, as Ali introduced very clearly, besides what's going on at the federal level, the approach that we use, we had two meetings in our state with Zero and with the congressman and senator, and we emphasized how it worked, but why it was important. And yes, I'm passionate about it as well. And I treat prostate cancer. I know prostate cancer. And I personally have seen a stage migration since the first recommendation that PSA testing got a D grade, was a negative test. It shouldn't be done. And that took a few years to seep into the practice of doctors. But as PSA testing decreased, we're seeing more advanced prostate cancer, and that's not curable. It's treatable, but not curable. And when those patients progress and they die, it's a miserable death with bone metastases, and they're not doing well. So it's difficult to see, especially since there was a previous stage migration in a good direction over the previous 20 years or so. But the numbers that I looked at were just not on a national level. Ali presented alarming numbers on the national level. I think those numbers are even higher than they used to be, because we're going to see the backlog of people who weren't diagnosed every year. So there's another about 10% increase per year. So the New Jersey, though, happens to have a higher prostate cancer incidence than the rest of the country. So that made it even more telling and more important to develop this type of program. There were ethnic lines. There was a higher incidence in Black patients and higher mortality in Black patients for whatever reason, whether it's socioeconomic or a different biologic disease or different access to care or all of the above. But I felt that what Zero was coming to me with was a very healthy, eye-opening attitude, because I didn't consider it before. I knew the value of the PSA, and I knew people weren't getting it because their primary doctors weren't advising it. But there was another barrier. Men are not ideal patients. They don't go to doctors the way women do. But the barrier in women for other cancer testings has been eliminated already, or somewhat eliminated. I'm talking specifically about mammography for breast cancer, and that with cost sharing, even as we said earlier, it's a small barrier. If it may be a copay, but even a copay keeps people away, and even people who can afford the copay, it does keep people away. So I think this will change the mindset of the patient, but it'll also change the mindset of the primary doctor, the insurance company, and also society. like nobody thinks, do I get a blood glucose as a test? Because we know diabetes is something we should check for, and if we detect it early, we could treat it and save lives. That's absolutely the case for prostate cancer, as opposed to, well, no, we don't want to even go there. So I think there's so many advantages, and you could apply it at your state level. You could see what the incidence is. It may not work for all states, but I looked at the map that Ali showed earlier, and it occurred to me New Jersey is sitting smack in the middle between New York and Maryland. So, it's like completing a monopoly on your monopoly board. You get all the orange colors, you're going to win the game. So that's how it worked. So we had some meetings, and the politicians were very receptive. And then after that, I was out of it, but then Ross and Ali continued to carry the ball, and we're hearing there's a bill. So
There's one bill, and I think there's going to be another, right, Ross? We're going to get bills in both the Senate and the Assembly in New Jersey. And Dr. Schulman, you made a great point, right? Shanita is a constituent in Burlington. She's a constituent for both the senator and the assembly member that we targeted. And we brought together this dream team, right, Ross? I mean, we had our organizations, which is nice, but we bring doctors, we bring patients, we do it all together. And that's really where we deliver the 1-2 punch of the story. But Shanita, I'm going to come back to you, because we got into that meeting and we knew you were a constituent. We knew you had a personal connection to the cause, but then you also had a personal connection to Senator Singleton. And it was just, for me, this great reminder that it's all local, right? When we're talking about state policy, you've done both federal advocacy, because you come to the summit and you've participated in those meetings. But why don't you tell us, what was your personal connection, and how do you think that helped us? I do.
Well, my husband went to high school with Senator Singleton. As soon as he saw the name, he said, "Oh, I went to high school with him." So I mean, Swiggett is not a common last name. So I'm sure, you see that last name, and generally everywhere around this area, at least, anytime anyone sees my last name, they're like, "Oh, I know your husband." So I believe that, any little bit helps, right? So just having that personal connection there, or just even, seeing the name and knowing that, okay, that's somebody I went to school with, and just that connection in itself, just with prostate cancer in general, almost everybody knows somebody in some way who's been affected, or you look at can be affected. So, seeing, okay, that's somebody I know, and that could be me in 5 years, or that could be a family member in 5 years. I think that, the personal connections definitely help.
We always try to find those personal connections, but I feel like when we're talking about state policy, and those districts are so small and it's all so close to home, it really does come through. Ross, we combined forces. Why? Talk to me about that and some of our other partners.
Yeah, like you mentioned, it's a real dream team here, not only from the physician perspective where I come from, but the patient advocacy with you and our industry partners. It's just been a real dream team that has leveraged its members, its connections, whether that's inside the industry or out, to form this diverse group. As Shanita was, and you had mentioned, a little tagline that I've been hearing lately is, politicians value stories over statistics. And Shanita was able to bring that story to the legislator, not only the personal connection, but also the story. Another fun, interesting thing in this example, the assembly sponsored, the targeted assembly sponsored, Assemblyman Herb Conaway. He's a physician, he's a public health official in the state. And he was also the recipient of the AACU's Distinguished Leadership Award some 10 years ago. And so we were able to leverage that relationship as well. So this dream team of patient advocates, physician advocates, and then also our friends in industry that have ponied up and helped us quite a bit with their advocates in the state as well.
And it really does. I mean, it just multiplies our reach, right? I mean, Zero is a growing but not super huge nonprofit, right? We're not the biggest out there. We don't have relationships in every district, in every state legislative district around the country. And so if we can come together and we can, reach out to a doctor that was recruited by AACU, and we can bring in a patient advocate, and we were also able to bring in other partners, right? We've had sign-on letters in different states, and 15, 20 groups from the prostate cancer community have signed on to show their support. And I think, that's how we really show the scope of the issue, how important it is, and, bring all of our powers to bear. So I want to ask, what kind of response we got? I know that Assemblymember Conaway was, obviously he's a physician, he was interested, but if I remember correctly, Senator Singleton also had a personal connection to prostate cancer, right? He ended up mentioning that his family also had, I don't remember exactly what the relationship was, but he had a grandfather or a father, he had family members with the disease. And I think we all know who the high risk groups are, right? We're talking about men with a family history. Senator Singleton is also Black, so there was increased risk there. And I really felt like we were able to resonate with him because we came together that way, right? Dr. Schulman, you were in that meeting. What did you feel like just hit him the most?
I felt both the senator and the congressman and the assemblyman did not need much convincing. And in fact, one of them knew a lot about prostate cancer already, maybe in preparing for our meeting, or maybe he's just aware of it because of personal connections or whatever reason. But this was an easy sell. So that, we did our job. I presented statistics, but as Ross said, personal stories are better. I have lots of personal stories, but that's not my personal self or family, but patients, but that's not what I was there for. So I'm wondering, Ross, can I ask you, but you're muted, the response in the other states that successfully done, was this a no-brainer, like politicians just want to write this, once the bill gets introduced, is it easy to pass? Because the objection should be it's costing state money, but it's not, it's costing whoever is paying for it, the insurance company and ultimately the insured, his premiums. But so how did that go in your experience?
Yeah, that was on the tip of my tongue. I presume we would get there, but it as excited as the two legislators that we spoke to were about it and how gung-ho they were to carry the water for us in New Jersey, it is not a slam dunk.
Okay.
However minuscule the cost of the test may be to insurers, they raise a stink. They do not want to open that door. And so, yeah, well, we've had a real struggle in other states. California got hung up in an appropriations committee. In Texas, likewise, it got hung up in the committee process, just because the insurance companies are just so strong,
Okay.
and they don't want to open that door. Yeah,
unless we
I didn't want to make it seem like, oh, it's a smooth sailing all the way through.
Okay.
No, this is like the introduction is just the first step, an important step, but the first step in the legislative process, of course.
Okay, because this talk till now has been, it seems like an apple pie, nobody objects to it, but I hear, of course, there's going to be objection. Although maybe we can convince them and show data that treating metastatic prostate cancer costs more than treating localized prostate cancer, and that the differential might be less than the cost of these tests, but I don't have that data.
It was that easy. We would the map would already be blue, right? We'd have done it in every state already, and we wouldn't have needed to come up.
Well, no, because until you took the initiative, this wasn't on my radar, as this is why I could be a more effective urologist if this was no cost sharing. I wasn't even thinking in those terms. So somebody had to introduce it. Okay.
I love the way you said that.
Breast cancer is at least a decade ahead of prostate cancer in a lot of medical, biological, but also socioeconomic aspects. So.
I love the way you said that it's going to help you be a better urologist, because I think that we can get hung up in, oh, well, the cost sharing, copays are small, right? Copays are just a little bit of money. But the fact is, when we talk about cost sharing, might be copays, it might be co-insurances, it might be deductibles. And what's small to one person may not be small to another person. Not to mention the fact that it's a message we send, right? It's the message we send to primary care docs. It's the message we send to patients, to insurers, to health educators. I mean, that's an important part of the conversation too. I want to mention also in Illinois, we actually had, it just reinforces, the argument, I think, that the most passionate people are the people personally affected. But in Illinois, the bill was introduced by a state representative who himself had prostate cancer. He was actually diagnosed at age 48. And the first doctor he went to, he asked for a PSA test. The doctor said no, it wasn't recommended at his age. The second doctor he went to did the PSA test. It was elevated. He was diagnosed with an aggressive prostate cancer, and he introduced the bill on the 1-year anniversary of his surgery. And to me, the most impactful thing he said was, if he had listened to the scientific recommendations for the general population, which shouldn't necessarily have applied to him as a Black man, he may not have been alive to get a PSA test when it was recommended. And that was just such, like, that's the headline, right? That's the story that brings you back here, right? I thought that was wonderful. And we're going to need now to find, what, Ross? We're going to find some doctors and some patients in Illinois too.
Mm-hmm.
But in the meantime, in New Jersey, we're going to, with the bill, the Senate bill's been introduced. We expect the Assembly bill soon. And then we are going to have to fight to move it forward. And it'll be, we had initial meetings, but we're going to need folks like Shanita and Dr. Schulman and all of their compatriots in New Jersey then to use their voices, right? To tell their stories to their members so that we can move forward, because it's not over, right? Like Ross said, it's the introduction's the first step, but there's a long road in front of that. And it's a road that, we've been derailed on before. So it is hardly a fait accompli. But Ross, you want to talk a little bit about how we're going to work together and what our next steps will end up looking like?
Well, you laid the groundwork for that, really, Allie, by saying, it is a matter of, getting all of our compatriots together. It is writing, organizational letters, certainly, from the Urology Society of New Jersey, AACU, AUA, ZERO. But it's also getting those grassroots mobilizations out there. AUA has been very helpful, and I would be remiss if I didn't just, AUA has been great on all these as well. AUA is leveraging its grassroots mobilization tool to help us get in touch with individual legislators when and if the time comes, when those voices will be valuable and useful to be able to mobilize the grassroots, to encourage it, to maybe get over a little hump, move it right at a deadline, whatever it might be. So yeah, down the road, it's counteracting insurers' arguments. I hate to be a broken record about the insurers, but they'll trot out statistics that we might not necessarily agree with or think are accurate, but whatever the case. So yeah, it's grassroots mobilization. It's getting our groups together to influence, at the committees and when and if it gets to the floors of the various chambers.
We'll have folks who testify, right? We've done that in some other states. Shanita, Dr. Schulman, I expect both of you to sign up to testify at a hearing at some point. I wanted to actually go back a little bit and Shanita, ask you, you've advocated both at the federal level, right, at the summit, and now you've also advocated at the state level. If you had to pick one, which one would you pick? And why?
The federal level was fun and exciting, just, being in the thick of everything with the summit. But I think I would pick the state level because there's more personal connection there. And I feel like there's more of an opportunity to kind of get a little closer to talking to everybody, so to speak. So, having a little more accessibility to assemblymen and the senators and everything like that. And, having connections, like my husband went to high school with Senator Singleton, and it's a little more of a knowing somebody who might know somebody who can say, okay, here's more of a connection, and kind of help the process along a little better. I've really enjoyed this process, just being able to talk with the senator and the assemblyman, and be part of, like, hey, I'm your constituent also. So I really have enjoyed the state level a lot.
I don't know, did you ever in any of your federal meetings have the actual member of Congress show up? Because we had both of them show up for these.
For the first year, yes. Well, actually, the first year we did have Assemblyman. I'm sorry, we had Senator Mendez. He was there, and Senator Booker showed up as we were leaving. So we had the opportunity to take a picture with Senator Booker, and the connection there was great. He actually we spoke briefly, and he also lost his grandfather to prostate cancer. So I said, hey, don't forget me. And Andy Kim, we had met Andy Kim both years. He wasn't in the actual meeting because of a vote, but he did make it again as we were leaving. So we had a chance to speak with him in the hallway.
Dude, I thought the point I was going to make was that you're much more likely to get your member of or your elected official at the state level. But darn, you lucked out, Shanita. Those are
we did luck out. I did hear a lot of people who just had the staffers on the federal level. But yeah, we lucked out. It was more of a, as we were leaving, we had the opportunity like for photo ops and whatnot, but it was mostly the staffers that we spoke with.
Yeah, I'm just wowed. That's great. Dr. Schulman, if you were speaking to other physicians about getting engaged in this kind of work, what would you tell them and why?
Okay, well, that's a difficult question. Well, it's a great question. It's a very good question, because I find some physicians get it, and I don't even have to talk to them. And some physicians just, they'll leave it to somebody else. I'm busy with whatever, my clinical practice, my other interests, my family, whatever. So they'll pay their dues or not, but they won't advocate. Okay. So what would I tell a physician to try to convince them? So I shouldn't be that assuming that we can change the world, because that's why we're here, right? We can change the world at the legislative level. So physicians, I would convince them why this is good for their patient. To a urologist, that should be a pretty obvious, but it's worth stating. And I would convince them why it would be good for them to care for their patients and have better outcomes. To convince them why they should get involved in advocacy. I'll need Ross to help me with that, because I don't do that. I chair a monthly meeting at one of my local hospitals, and it's on the agenda of what organized medicine is doing for us and what we should be doing for them, and join the AACU, for example. And I get some apathetic faces. So that I don't want to share that with this panel, and you're going to be showing this to other people. But I'll tell everybody, get involved and do your share, because it's better for the society, it's better for your patient, and thus it's better for you personally as a physician. And it's the right thing to do. That should be enough of a sell. Okay, and even if it's not easy. Okay, so I wasn't expecting the question, but
It's okay.
Okay.
And thank you for, I mean, this is how you serve your patients, right? This is one of the ways is by
Okay.
changing the
And,
structures
and,
below
since,
them.
and since I've been invited to this panel, I'm enjoying it as well. So it's another way of diversifying efforts. Okay.
I'll take it. We'll have you back anytime.
Okay. Thank you.
Ross, how do you make the pitch? This is important work, but I want to hear somebody else make it.
Yeah, as far as I'm concerned, that's my daily struggle. Is trying to get people engaged and taking action. For me, I try to explain how easy it is, how simple it can be. Dr. Schulman had sort of laid the groundwork. He sort of suggested, at minimum, join professional organizations, participate in a zero run walk. And then you can slowly grow depending on your passion and your own personal time. But at the very minimum, I would hope that individuals, I would hope that physicians at least support these national and state organizations that can do a lot of the groundwork that cannot be accomplished as an individual. I would say that it takes organizations to open some of these doors, to leverage their collective power to again open some doors and get some action on these important policies.
Now I just feel lucky because I've got folks like Shanita, right? I've got patients and caregivers and people who are personally affected, and y'all raise your hands so fast that I feel great sympathy for you, Russ and Dr. Schulman. I want to wrap up today just by saying thank you to the three of you, not just for being here, which has been great, but also for the work you're doing in New Jersey. And we are, knock on wood, we are going to pass that bill, and we're not going to come back to New Jersey for a while. And so Shanita will have to spend all her time on federal issues. Dr. Schulman will have to just see patients. We'll take a little break at ZERO New Jersey, but we couldn't do this alone, right? It takes organizations, it takes coalitions, it takes teamwork. And I am so grateful to all of you for being a part of our team. And I want to invite anyone watching to please, when you get that email saying take action in your state, it's time to make a phone call. It's time to send an email. Click on that link, right? Answer the phone when it rings and it's my voice on the other line, on the end of the line saying, I'm going to patch you through to your elected representative. We make it really easy. And we give you the opportunity to be as involved as you want to. So please take that chance. I mean, it's a way to take your story to use it for something good, right? Take something that is, it's an unwelcome brotherhood, it's an unwelcome family, but it's one that we can use to save others. So thank you all for your time and thank you for your efforts. And I'm glad that we get to share this with everyone and to have you join us going forward.
Thank you.
Thank you so much.
Thanks a lot.
Thank you, everybody.